Tonification nourishes the chi when they are deficient or weak, where sedation is always used in excess conditions. We use these both techniques in order to get the balance in the chi. This video will help you in learning tonification and sedation techniques, different techniques, where you can use in your treatment whenever it is necessary. Welcome to my channel. My name is Dr. Bhargav. I am the licensed acupuncturist and a founder of Acupuncture Made Easy, where I teach different acupuncture techniques in an easy way. Before we get into this video, please subscribe to my channel and hit the bell icon so that you will be notified first whenever I release the video. Yeah, so in this video you're gonna know like why you have to tonify and why you have to sedate, give a sedation effect, and I will also tell you about like different methods like where you can get a tonification effect and how you can get it, or even a sedation effect in the treatment room when you're doing it, and it can increase the therapeutic effects of your treatment outcomes. So usually if anyone has, we know that the cause of disease can be either due to deficiency or it can be due to like excess. Yeah, so if anyone has come to you with a condition with a deficiency disorders, then you have to tonify them. You have to give the tonification so that the balance can happen. And at the contrary side, if anyone has come to you with an excess condition, excess type of condition, then you have to do a sedation on them in order to calm down so that it will attain the balance. Okay, so that's why we do the tonification and sedation technique in addition to the normal acupuncture treatment which is going on. And one of the method, like it's a very basic method which most of the acupuncturists follow, is like if you needle along the pathway of the channel which follows the channel pathway, then you can get a tonification effect. And whereas if you needle direction against, opposite to the channel pathway, then you can get the sedation effect. The needling should be it can be towards the following of the channel pathway where you can get a tonification effect, and if it is against, then it is a sedation effect. As you know that when the chi, if the chi is following towards the channel pathway, then tonification can happen. But in an excess condition, if the chi is too high, then you want to break that, you want to sedate it, and the only way you can do it through the needling is by against the direction of the needling towards against the channel pathway. And the second method is like by twiddling and rotation of the needle. I have seen so many acupuncturists, they do this method, but it has to be exactly like why you are doing it. Either you're doing it for tonification effect or are you doing it for sedation effect, and each of these has its own technique to get those effects. Okay, if you are rotating the needle clockwise, which is forcefully and rapidly, then you can get a tonification. Whereas if you rotate the needle anti-clockwise, which is forcefully and rapidly, then you can get a sedation. So in tonification it will be clockwise, forcefully and rapidly, and in sedation it is anti-clockwise, which is forceful and rapid. And while after doing this first rotating clockwise, then when you want to get the tonification effect, then you have to rotate the needle anti-clockwise, but it has to be gently and slowly. So these two both combine, twiddling and rotation will give tonification effect. At the same time, even after doing an anti-clockwise, forceful, rapid rotation of needle, then for the clockwise, in the rotating the needle clockwise, which is gently and slowly, then you can get a sedation effect. So these two combined gives the sedation effect. So that's how you can get the tonification and sedation, by twiddling and rotation of the acupuncture needle. And the third method is like how you insert the needle and how you withdraw the needle also gives an effect. So when you insert needle slowly, then the tonification can happen, because when you insert needle slowly, the dispersion of the chi in that meridian is not happening. Okay, so the chi accumulation takes place, so the tonification can happen. And withdrawal of needle should be rapid, because you don't want to disturb the flow of the chi. Okay, so you insert needle slowly and withdraw it needle rapidly, then that gives you a tonification effect. Whereas sedation, insert needle rapidly, because you want to break the excess of the chi which is flowing. So if you insert it rapidly, then the chi can disperse, then that can give you a sedation effect, and you have to withdraw needle slowly. Okay, so that's how you can get tonification and sedation effect, by insertion and withdrawal of even acuneedle. So the last method is a thrusting and lifting. This is nothing but the way you insert the needle and the way you lift the needle, and at each times how many times you have to thrust, you have to apply the thrust, and with what force you have to apply the thrust, and how you can remove it and withdrawal of the needle. This all combination of three different types of tonification and sedation techniques will give you the thrusting and lifting kind of tonification and sedation methods. So if you want to get a tonification, so the needling should be slow and thrust heavy rapid 9 times at each level. So we have in the needling, you know that we have superficial needling, then medium needling, then deep needling. So superficial layer or medium layer or deep layer, you can also take it in that way. So at each of these levels 9 times you have to thrust heavy rapid and lift gently slowly 9 times at each level, and at the end the withdrawal of needle should be rapid. This is a complex type of method where you can attain the tonification and sedation, because it is a combination of 3 different type of tonification and sedation techniques. And if you want to get a sedation technique, then insert the needle rapidly, and thrust will be with a slow and gentle speed, but it has to be only 6 times at each level, whereas in the tonification it has to be 9 times, but in sedation it has to be 6 times. And the withdrawal of the needle should be slow. In tonification, withdrawal of the needling will be rapid. Okay, I'm gonna show you at each level how you can do it with my digital slate. So how you can get a tonification? So imagine that this is a layer of the skin, superficial layer of the skin, and based upon 3 different needling depths, okay, a superficial needling, medium needling, and deep depth. Superficial needling, medium needling, and deep needling. Okay, so once the needle is inside, like the insertion of the needle should be slow, and once the needle is inside, after getting inside the superficial, it is piercing inside, then once if it is inside, then you have to apply the thrust heavy rapid. Okay, rapid thrust should be applied at each levels for 9 times. Okay, 9 times at each depths. Okay, and you have to lift it slowly and gently. Okay, Inserting thrust will be rapid for 9 times on each layer, superficial, medium and deep needling. Then the lift will be gentle and slow, and that has to happen on each level for 9 times each, and then you can get a tonification, because the thrusting and lifting technique is nothing but it's a combination of 3 different types of tonification and sedative techniques. Okay, which is nothing but during insertion it is one, and second one is this withdrawal. Yeah, I forgot to tell about the withdrawal. The withdrawal of the needle at the end of the treatment should be rapid. Okay, rapid withdrawal. Okay, so this is third and this is second type. Okay, so these three combined will give you a tonification effect in the thrusting and lifting. Okay, whereas if you see how you can get a sedative effect, okay, with the same technique, sedation. So the same skin surface, superficial layer, so 3 different type of needling: a superficial needling, medium and deep needling. Okay, so insertion of the needle will be rapid. Okay, so if it is a rapid insertion, the needle depth can go until very deep. Okay, deep needling. So the insertion is rapid, which is first type of technique. And after once the needle is inside, then you have to thrust it slowly, thrust slowly and lift rapidly. After the thrusting has happened, slowly you have to lift the needle rapidly, and this has to be happening 6 times at each levels. Okay, 6 times at each level. So the insertion will be thrust will be slow and gently, lifting will be heavy and rapid. Then at the end of the treatment, the withdrawal should be slow. Okay, so that's a first, second and third. So all these 3 combined will give you a sedation effect. Okay, so remember that in tonification it is 9 times at each levels, the thrust and the lifting after the insertion of the needle inside the body, and in sedation it is at each levels it should be 6 times. Okay, thank you for watching this video. If you like it, please subscribe to my channel and like the video, and if you have any doubts, put in a comment section so that I can reply for your doubts. Thank you so much. Have a great day.